This video is brought to you by Global Men's Wellness, your 24/7 AI health expert. No copays, waiting rooms, or awkward conversations. Just real answers whenever you need them. Visit globalmenswellness.com to try it free and get your own on-demand concierge-level wellness expert. Global Men's Wellness podcast. In this episode, we're going to explore the entire landscape of treatments for erectile dysfunction. For the last 30 years, the conversation has been dominated by the breakthrough discovery of oral medications. But science doesn't stand still. What happens when that first-line therapy isn't enough? Today, we'll look at the full spectrum of options, from proven, existing therapies to the cutting-edge strategies that are shaping the future of men's sexual health. First, let's be clear on our terms. Erectile dysfunction, or ED, is defined as the consistent inability to get and maintain an adequate penile erection for satisfactory sexual intercourse. It's incredibly common, affecting up to 40% of men between the ages of 40 and 70. I like to use the metaphor of a check engine light. ED is rarely an isolated issue. It's often a sign of an underlying neurogenic or vascular problem, and it frequently appears alongside conditions like hypertension, diabetes, or atherosclerosis. It's a real medical condition with a significant impact on a man's quality of life and his relationships. To understand the treatments, we need to understand the basic biology. The key event in an erection is the relaxation of the smooth muscles in the penis, specifically in the cavernous corpora. When these muscles relax, blood is allowed to flow in through the arteries, filling the tissue. This influx of blood compresses the veins against the penis's tough outer layer, the tunica albuginea, which dramatically reduces blood outflow. This process creates the rigidity needed for intercourse. This state of relaxation is controlled by your nervous system. Think of it as having two competing signals. One is a noradrenergic signal, which keeps the muscles contracted and the penis flaccid in its normal state. The other is an inhibitory signal, primarily driven by a molecule called nitric oxide, or NO. When you're sexually stimulated, the brain sends a message to release NO, which overcomes the contracting signal and causes the smooth muscles to relax. Nearly all modern treatments are designed to either boost that relaxing NO signal or block the contracting signal. So, how do we apply this in practice? Urologists think in terms of treatment tiers. The first line of therapy, and the most widely known, is oral phosphodiesterase type 5 inhibitors, or PDE5 inhibitors. These are drugs like sildenafil, tadalafil, and others. They work by amplifying that nitric oxide pathway, making it easier for the smooth muscles to relax when you are sexually aroused. They are highly effective for many men. However, as we discussed, there are many cases where these drugs are not effective or can't be used. That brings us to the second line of therapy, local treatments. The most common of these is intracavernous injection therapy. This involves using a tiny needle to inject a combination of medications directly into the penis. The most common combination includes drugs like phentolamine, which blocks the contracting signal, and prostaglandin E1 or papaverine, which directly promote relaxation. While it may sound intimidating, it's a highly effective therapy that produces a reliable erection for men who have failed oral pills. For men with intractable ED, where even injections are not a viable option, we move to third-line therapies. These have been around for a long time, but have been technologically perfected. They include the vacuum erection device, which uses negative pressure to draw blood into the penis, and the gold standard for a permanent solution, the penile prosthesis. Modern prostheses are three-piece inflatable devices surgically implanted into the body. They allow a man to control his erections with a small, discreetly placed pump, simulating the natural process of becoming erect and flaccid. These devices have one of the highest satisfaction rates of any medical implant, routinely reaching 85 to 90%. All the therapies we've just discussed are on-demand treatments. They work for a single encounter, but the holy grail of ED research is to find a long-lasting, restorative cure. This is where the future gets very exciting. One of the most talked about areas is low-intensity extracorporeal shockwave therapy, or LIESWT. This non-invasive procedure uses low-energy acoustic waves applied to the penile tissue. The theory is that these waves stimulate the body's own healing processes, promoting the growth of new blood vessels, improving nerve regeneration, and recruiting the body's own stem cells to repair damaged tissue. While it's very promising, the clinical results have been mixed, and the medical community is still working to standardize the treatment protocols to figure out who it helps the most. Another major frontier is regenerative medicine, which includes stem cell therapy and platelet-rich plasma, or PRP. The idea here is to inject these powerful biologic materials directly into the penis to restore damaged endothelial cells, smooth muscle, and nerves. Dozens of preclinical studies in animal models have shown this approach can work, but human trials are still in the early phases. These therapies are complex, expensive, and not yet easily reproducible, so they remain highly experimental for now. Finally, one of the newest and most surprising strategies being tested is the intracavernous injection of botulinum neurotoxin A. You probably know it as Botox. The idea is that Botox can temporarily block the release of the neurotransmitters that keep the penile muscles contracted, leading to a state of prolonged relaxation. In early trials, this has shown some success in men with very difficult-to-treat ED, especially when combined with a PDE5 inhibitor. Alongside restoring the penis, researchers are also looking back to the brain. We know that centrally acting drugs can also play a role. While the drug apomorphine, a dopamine agonist, was used in the past with modest success, new research is looking at more selective dopamine D4 receptor agonists. The hope is to find a compound that can effectively trigger the brain's erection command center without the side effects, like nausea, that limited older drugs. Similarly, researchers are trying to develop analogs of peptides like oxytocin and melanocyte-stimulating hormone, which are also known to have powerful pro-erectile effects originating in the brain. So, what's the big picture here? It's that the field of men's sexual health is more dynamic and hopeful than ever before. We've moved from a single solution to a multi-tiered, highly personalized approach. The right treatment for one man might be completely wrong for another. The choice depends on the underlying cause of your ED, your other health conditions, and your personal goals. This is why I do this work. It's about being a partner with my patients, navigating this complex landscape together, and refusing to accept that there are no more options. From proven oral pills and injections to permanent surgical solutions and the promise of regenerative medicine, the toolbox is deep and growing. The most important step you can take is to start the conversation with a specialist. There is a path to restoring your function, your confidence, and your quality of your health anytime, anywhere. Visit globalmenswellness.com and start your free trial today. Get expert-level answers in seconds, not weeks, without the cost, the wait, or the awkward conversations. Real support on your terms. Visit globalmenswellness.com now.